Clinical depression, also known as major depressive disorder, is one of the most common mental disorders in the U.S. According to recent Centers for Disease Control and Prevention data, approximately 1 in 5 U.S. adults reported having received a diagnosis of depression by a healthcare provider. For some individuals, depression can substantially impact certain life activities.
The depressed patient doesn't want to go anywhere. They don't want to do anything. They want to be by themselves. And they often experience symptoms like crying spells, feelings of guilt, and changes in appetite and sleep.
And while there are a number of medications that work well in treating depression, experts are finding that nearly a third of depression patients are actually resistant to the effects of these medications.
So, to be diagnosed with treatment-resistant depression, a patient has to fail at least 2 antidepressants. And anyone that's familiar with kind of psychiatry knows that that's not a really hard criteria to meet.
But healthcare workers like Cammie Harris are finding ways to treat those with resistant depression.
In my clinic, I see treatment-resistant patients every day. And I have been using Spravato, which is an S-ketamine nasal spray that works differently in the brain than other antidepressants. And my patients have gotten better, and they've gotten better faster.
And Harris says if you're having feelings of depression or your current treatment is not working, you need to reach out for help.
I think the most important thing to do is to get help and actually be really active in your care. So schedule that appointment with your healthcare provider. Talk about your available options.
And she says there are other things you can do as well.
The first thing that you can do is maintain a positive mindset, which is obviously easier said than done. You know, it's hard to feel depressed and stay positive. The second thing is incorporating therapy with your medication. The evidence supports that therapy plus medication improves overall outcomes. And my favorite, the secret weapon, exercise. Exercise has been proven to increase the body's natural antidepressant.
If you or anyone you know is suffering from depression or treatment-resistant depression, there are some wonderful resources to get the help you need.
I want to let you know that help is available. If you're feeling depressed, if you're feeling suicidal, please call or text the crisis hotline at 988. Reach out to your healthcare provider. And then lastly, if you want more information on treatment-resistant depression, please visit Spravato.com.
If you need help, take advantage of these resources. I'm David Wiley for Coast to Coast.